Kiran Dr. Kiran Rahim. I am a paediatric registrar currently working in London, and I am a paediatric, so a children's doctor. So that's what I do for a day job. Just a disclaimer, I am not here to give you any personal medical advice, and this does not replace any individualized advice you may have received about anything that we're going to cover in the next sort of 15 to 20 minutes. So another disclaimer, I am on maternity leave. So alhamdulillah, I had a little baby girl about 5 months ago. So I'm currently not practicing, but I will inshallah return to clinical practice in the next couple of months. So I am delighted to be talking to my Muslim Mama audience about vaccinations today. As a pediatric doctor, this is a big part of what I do, public health information and sort of sharing evidence-based practice. So over the next sort of 10-15 minutes, I'm going to be covering the MMR vaccine in particular. So that's the measles, mumps and rubella vaccine. I will be talking about, why we're talking about it now, what it is, how does it work, what the conditions are it covers, and why we want you to get vaccinated. As ever, if you are inshallah watching and you have some questions, please just let me know. I have got my question box open simultaneously. Sometimes there's a bit of a delay, but I will try and get through everything as swiftly and as accurately as I can, inshallah. So let's get cracking. So why are we talking about the MMR vaccine? So the reason it's come to light is because obviously, as you know, with the pandemic in the last 2 years, things in the NHS, although they've been running as normal, we have noticed a decline in vaccination uptakes for various reasons. And the UK Health Security Agency and the NHS are reminding all parents and guardians to ensure that their children are up to date with their MMR vaccine, which is again the measles, mumps and rubella vaccine, as well as their other regular immunization, because the data that we've had coming out shows that there has been a decline in uptake, particularly of the MMR sort of in the last decade. And GP practices and vaccination centres are continuing to offer routine childhood vaccinations, and that's what MMR is. It's one of the routine vaccinations. So the MMR vaccine is a single injection. So if you've got a sort of young baby or a little toddler, it's usually given in the thigh, and if in slightly older children, it's given in the upper arm, or if you haven't had it and you have to have it as an adult, it's given in the arm as well. So it's a live vaccine. So what that means is that it has bits of the virus which have been weakened, and so the purpose is that they induce an immune response in your body, so that your body produces antibodies to fight the disease, but it doesn't actually cause the disease. We have very, very good evidence on the MMR that it's particularly safe, and it usually offers long-lasting protection with just 2 doses of the vaccine. So for those of you wondering, the MMR vaccine is given when your baby is around 12 to 13 months, so around that period. So that's the first dose. And then the second dose is usually just before they start preschool or nursery, so around 3 years, 4 months. And I say around because you may have it just a bit before or just a bit after, but it's usually around that time. And like I said, it's lifelong protection, so it's really, really long lasting protection. So the reason we're talking about it is because it covers 3 really big diseases, and I don't think people appreciate what we're protecting against. So the first big one it covers is measles. So measles is a very, very infectious viral illness that is spread through. So it's a virus of coughs and sneezes, and it's very, very contagious. So before the vaccine was introduced, we had lots of measles-related deaths and outcomes, and you can get really, really very unwell with it. And there are lots of serious complications that we do need to consider. So as well as things like ear and chest infections, as well as pneumonia, so like a lower respiratory tract infection. It can also cause brain inflammation. And also, one of the things with measles is that you may be fine once you've had it and recover if you're non-immunized, but later down the line, so, you know, in 10, 20 years, you can get a really bad encephalitis, so brain inflammation, which can lead to disability and even death. And this, you know, it's now uncommon in the UK because of the vaccine, but before the vaccination was introduced, there were lots of complications from the measles virus, and because it's so highly contagious, it's something that we really worry about. Now, the other M in the MMR is mumps. Again, this is a viral infection, and it used to be common in before the vaccination was introduced. And then the final one is rubella, which is otherwise known as German measles. So, but that's a bit old. And again, you get a really bad spotty rash and viral illness with rubella. Rubella is particularly it's particularly bad for pregnant women. So, you know, that if you, and this is why we also want to protect and vaccinate, because we want to protect those around us. So if pregnant women get rubella, it can have quite serious consequences for their babies. So this is why we encourage all children to have their vaccination, so that when they go on later in life, they are really protected. So for those of you wondering, how good is the MMR? So the MMR was introduced in the late 1960s, and we have data that shows that approximately we've avoided 20 million cases of measles and about 4,500 deaths, which is really fantastic news. And you know, before the vaccine was introduced, there were lots of complications. Children did die of these diseases, so it's not something that, you know, there's a lot of, oh, we can just have it, where you can't, because you don't know who's going to have serious outcomes and who isn't. It's very, very affected. So almost 99% of people will be protected against measles and rubella after the 2 doses, and about 88% will be protected against mumps. And that's just because of the way the virus is evolved and the data that we have on it. Even if you are protected, so, you know, with that 88%, so if you are protected and you then get, like, for example, mumps, you are much more likely to get much less likely, to get anything serious happening, because you've got the antibodies that your body has given you once you've had the vaccination. So for those of you that are wondering what are the current rates of MMR vaccine, or if you can't remember if you've had your vaccine or if your child has had your vaccine, the easiest way to check is in the Red Book. So every child in the UK should have a Red Book that records sort of their progress in the first 2 years of life. So there is a section on vaccination, and there will be a section on the MMR. So if you have missed it or you can't remember, go and check your Red Books, and then you can book across GP practices near where you are. And just a reminder that the NHS is continuing to offer, you know, regular routine childhood immunizations as well. And so the reason I think we're really encouraging is at the moment is because the current data shows that almost 1 in 10 children in England haven't had their first dose. So that dose around 12 months, they haven't had that by the time they're 2, and 1 in 10 children also haven't received their second dose of MMR. So that's the one that you have preschool, so around 3 years and 4 months. And I know the pandemic has disrupted lots of things, and it may have been difficult for some of us to access routine appointments, but please get in touch with your GP practice, or if you have any questions, you know, they are all happy to discuss these things. If you have any concerns, I think it's really important that we talk about vaccines in an informed way, and that's part of, you know, why we're doing things like this, is to help you make an informed decision, because you shouldn't do anything just because I say so, or just because your friend down the road say so. It's about making informed choices from the best evidence available. And I don't think we could have an honest discussion about MMR and not bring up autism, because one of the things that I often get asked as a paediatrician in my routine practice is that, are you concerned that MMR causes autism? And actually, I always say that we as a scientific community can quite, you know, answer with quite some confidence that actually we know the MMR doesn't cause autism because it's been investigated so thoroughly. Like we actually we have some idea of what causes autism, but we don't have the bigger picture. But we definitely know it's not the MMR because it's so well studied. And there is no evidence between any link between the MMR vaccine and autism. We have had lots and lots of studies and evidence that has looked into this, studies that look, that have assessed over 1 million children. There's lots of papers from all around the world that are very reliable, that are peer reviewed, that, that the authors haven't got anything to declare. They're trustworthy sources, and lots of studies have investigated it, and no link has been found. So I always reassure parents that it is a very safe and effective vaccine, and that actually most children just have mild side effects. So things like having a bit of a fever afterwards, maybe, or having a sore arm, or just feeling a bit rotten, but they usually subside after 24, 48 hours. And I think it's really important to remember that those, with vaccination, the side effects of the vaccine, so things like temperature and high fever, temperature and sort of sore arm, are much less, are much less bad than like getting the actual viral disease itself. So measles is quite a serious disease. Most people think it's not that bad, but thousands of kids died from measles before the vaccination was introduced, and the side effects are more serious than the possible side effects you get from the vaccine. And I think it's really important that we remember that. One of the other concerns I often get, because as you know, I'm a Muslim doctor, so a lot of Muslim parents are concerned that the MMR vaccine has porcine gelatin in it. So just to say that there are lots of schools of thoughts about this. So some schools of thought say it is permissible, so you need to do what you're comfortable with. And some schools of thought say it isn't permissible, but there is an alternative available. So there are 3 vaccines in the NHS childhood programme that have porcine gelatin. So it's the Fluenz nasal spray, so it's the one that children get, the flu vaccine, the MMR Vax Pro, so that definitely has porcine in it, and then the vaccine for shingles, which is the Zostavax. So if you don't want that, that's absolutely fine. With the MMR, you can request the Priorix, so it's the non-porcine or non-gelatin vaccine. But if you are booking in for your MMR, it's really important that you let your GP know so that they can order it in, inshallah, in advance, because some places don't have it. Or, for example, if there's been lots of Muslim children attending that day and they may have run out because they don't have it in stock, it's better to let your GP know that's the one you would like, so that they can order it in advance. So that's the MMR in a nutshell. Now, if you're not sure, remember, check your red book. If you've missed the appointment, don't worry. You can phone your GP surgery and you can arrange a catch-up schedule, and also you can catch up on all the other ones you've missed. You just need to have that conversation with your GP practice doctor or your GP practice nurse. If you do need the full, so if you do need the 2 doses, so if you've missed the first and the second dose, which some people may have because we've had a 2-year pandemic, then you can have both of them in a few months apart. So it's between 4 to 6 weeks between the first and the second dose, but they can be given a month gap in between as well. So these are just things like your GP can talk to you about the best schedule for you, for your child, with keeping with other vaccines as well. So in summary, what we are asking you to do is to attend your child's MMR vaccine appointment, make sure you check whether they are eligible, whether they've missed any vaccines, and as well as the MMR, check they've had all of their other routine vaccinations. And if they haven't yet had them, so if your children aren't of the age where they are ready for the MMR vaccine, then it's something for you to explore. There's lots of information available on the NHS MMR site, and I will get the Muslim mamas to share the link to that. I will also be talking about MMR, inshallah, on my Instagram page. So I will host a Q&A on there. So if you have any questions that I haven't been able to answer here, I will address them. And if you have any concerns about them, this is the best place to ask, because we can have an open and informed discussion about it. And some of you may be watching and thinking as an adult that I'm not sure if I've not had it. And if you haven't had it, just have a chat with your GP. You can check it. You can check it with your GP doctor, with your GP, and then we can catch you up. But the purpose of this talk particularly is to encourage parents to get their under 5s vaccinated. So your first dose at 12 months, second dose at 3 years 4 months. So please continue to access our services. So I'm just going to have a quick look to see if I've had any questions. So it says here, Salam, Kiran, we have had our MMR booster, but I am very skeptical about the benefit versus risk for MMR. Thank you, Halima, for your question. I'm not sure what you mean by the very skeptical benefit versus risk. So from what I've seen, it's viral symptoms that generally most children recover from. I'm not sure exactly what you're talking about. Are you talking about recovering from the MMR, or are you talking about recovering from from actual virus of, like, for example, getting measles, getting rubella, getting mumps? Because if that's what you're referring from, I can share data with you. I can also share the studies related to autism if you would like. But the best evidence for how effective the MMR is to look at the number of deaths related to measles before the couple of years before vaccinations was introduced, and then after vaccination, and you can see a steep decline. And it's actually really interesting that you say that most kids only have viral symptoms, and I would agree that for measles, most children do have, you can have a cough, very high temperature, but the reason we don't have recent data on whether they get ear infections, pneumonia, whether they get SSPE, so that's encephalitis later in life, is because of the vaccine in the last 50 years, most of that has been eradicated. So we only really have a few outbreaks here and there. And you're welcome to look up the outbreaks that have happened in England in the last sort of 10 years, and there have been quite a few. But just because children get viral illnesses, like I said, remember with measles, they can also get the encephalitis 10, 15, 20 years down the line. And that's the thing that we worry about, because the encephalitis that you get with measles, it's called SSPE, so subsclerosing panencephalitis, and that can lead to profound disability and even death. And in my own practice, I have intubated one child with measles, which was awful, and that was in the last outbreak that we had near where I work, and it was an unvaccinated child from a minority community. And I obviously don't want to go into details because of the patient confidentiality issue, but it is a real risk that you're taking. And for those of you that are wondering, I'm a mum, so I don't take these decisions lightly. I have 3 children, so I have 2 boys and a little girl, and they are aged 8, 5, and Amal is 5 months. And all of my children are vaccinated with the MMR and their routine childhood vaccinations, except for Amal. Amal hasn't had the MMR because she's 5 months, but she will be having it when she turns 12 months. So, this is not something that I'm just saying because I'm a doctor and that's what I should do. This is also something I believe in, and I get my own children vaccinated. Halima, I will share the data if you'd like. Just drop me a message and then I'll give it to the admins to share as well. That's the only question I can see coming through so far. So I'll hang around for a bit. So just to remind you, the MMR is very effective, very safe. 2 doses, offers 99% protection against measles and rubella, 88% protection against bumps. There has been a general deep downward trend in the uptake of the MMR in particular in the last decade. So this campaign is just encouraging parents to check their red book to make sure if they've had it or if they've missed it, they can book an appointment with their GP. And remember, if you don't want to have the porcine gelatin one, you can contact your GP practice and ask them to order you the non-porcine content one. because I think it's really important that we have choice, and alhamdulillah, we are in a position where there is choice available. Right, so the other thing I wanted to quickly cover was herd immunity, which is something people bring up in particularly with measles. So measles is really, really contagious. So we need high levels of herd immunity, so over 93% in the community for there to be herd immunity. So what that herd immunity means that there is enough people vaccinated so that the disease can't spread. And because measles is so contagious, we need a very high level of that. So there are lots of people that can't get vaccinated. So for example, people that are immunosuppressed, that are on cancer treatment, children under the age of like 1 or 6 months, and children that have other diseases, and also adults that have other diseases. So in order to protect those, pregnant women, for example, as well, we do encourage vaccination as a way of herd immunity. So just wanted to touch upon that point because it does get brought up often. So I'm going to say Salam now. So that was just a quick summary of the MMR vaccine. I will inshallah share the studies on autism in particular. And Halima, if you just clarify what kind of data you want, then we can have a chat about that in terms of risk versus benefit, because I wasn't very clear. And then remember, I will be doing a takeover, inshallah, on my own page, and I'm happy to share it with the Muslim mamas on MMR, not tomorrow, on Thursday, and I can answer any direct questions there. So yeah. I hope you all enjoyed that, and inshallah you learned something positive, and that you are able to make an informed decision based on evidence-based medicine about what to do for your child. So look after yourselves, everyone. Keep me in your du'as, inshallah. Ramadan Mubarak, if I don't speak to you before the holy month, and keep me and my family in your du'as, inshallah. Take care, and assalamu alaikum.